An emergency use authorization for Pfizer's booster shot for populations at high risk. Millions of Americans now able to roll up their sleeves and get a third shot. Hi, thanks for joining us. I'm Dave Elliott. We're going to start with that, booster shots in our community in the ongoing battle against COVID-19. Singing River Health System pulmonologist Dr. Ijlal Babar joins us now with more. Dr. Babar, always a pleasure having you on the show. Let's start with that. Pfizer gets the approval for the booster. Moderna pressing forward with their plans for a booster. Those would be third shots, of course. And even Johnson & Johnson is talking about a second shot or a booster. What are your thoughts on this?
I think that, Dave, I think that the boosters are something that are going to be required. I think there's good evidence that with time there is waning immunity, and when you have to contend with variants like the Delta virus, you want all the immunity you can get. So we're fortunate in the United States we have access to these boosters, and so I think we should. All of us who are eligible should get these boosters.
So what would you say to somebody, and a lot of people feel this way, you know that, just look at the vaccination rate in Mississippi. What would you say to people who said, I did my part, I rolled up my sleeve, I got my vaccine, I was led to believe that that was going to be good enough, and now I'm hearing about a booster shot?
Well, it's kind of like the influenza vaccine. You know, you have to take a new shot every year because there's variation in the virus. We're kind of dealing with the same situation out here. If anything, the stakes are higher out here. So I think we need to do whatever we can to protect ourselves. It's our own protection. So, you know, that's what this is all about.
So Pfizer's talking about specific groups and situations, and we'll talk about that in just a second. But healthcare workers right on the front lines, exposed regularly. I hope you don't mind me asking kind of a personal question, but do you know a lot of doctors, and have you already received a booster shot?
So I still haven't. And that's mainly because I just haven't had time to go over to our Pascagoula campus to get it. I intend to get that as soon as I can. I do know a lot of doctors who have received the booster. I also know a fair number of healthcare workers, not just doctors, but nurses, who've had the virus, although they were fully vaccinated. They didn't get really sick, you know, not sick enough to be in the hospital, but they, you know, had the fever and the body aches. So I think that the protection is definitely required.
And do you agree with the CDC when they say basically 65 and older, 50 to 64 with some kind of underlying medical condition or comorbidity? What advice would you have for people who are in those particular demographics or those particular situations?
I was actually I was expecting them to be more restrictive. I am actually quite happy with this, this ruling, this guidance, because I think it really opens the doors for a lot of people to get this extra protection. So I'm going to encourage everybody.
All right, let's talk about the different waves, the so-called fourth wave with the Delta variant. Positive cases back in May and June had plummeted, and then suddenly after July 4th, they shot up. We were reporting 4,000 to 5,000 cases a day. Now we're down to about 1,500 cases a day. What's your take on this roller coaster ride, on this ebb and flow of cases?
Well, David, first of all, I think personally for us, this was much worse than anything we experienced in the previous surges. This surge was just completely, took us by surprise. We didn't expect the patients to be as sick and as many as we dealt with. So, you know, also one of the unique things in this surge was how many young people were getting affected and how sick they were getting. So, you know, the ebb and flow is something I think we have to kind of resign ourselves to, and to the fact that there are going to continue to be variants coming out. Now, the thing for people to realize is that variants will develop if the virus gets a foothold in the population. So if everybody gets vaccinated, if everybody does their part, the chances of that happening goes down.
Yeah, that's that herd immunity we talk about, and that's the way to try to stop the virus dead in its tracks.
Yes.
Since we're talking about numbers, let's talk about hospitalizations. Just a few weeks ago, I think the number was 1,600. Now, as of Friday on this week, we were down to 745. What's the situation that was statewide. What's the situation at Singing River, and what's your sense of where hospital resources are right now?
So, David, right now we have just 50 between our three campuses. At our worst, which was about 3 or 4 weeks ago, we were 150. The number of people in the ICU is down to about 22. At its worst, it was like 40 to 50. And on the ventilator, we still have about 18 people. And at its worst, we had about 30, 35 on the ventilator. The one thing that is taking much longer is the ICU numbers aren't going down as quickly as the overall numbers are. And part of the reason is because these are younger people, and they're managing to survive on the ventilator for far longer than we experienced in the previous surges when we had people in their 60s, 70s, 80s. Now we've got people in their 50s, 40s, even 30s. And so that's why we have longer lengths of stay in the ICU and on the ventilator.
Let's talk a little bit about treatment. The monoclonal antibody infusion has been called a miracle by some. Now we're hearing that monoclonal, that's going to be a subject for another day, that they might actually be rationing that particular treatment, which I don't understand. What have you seen from the monoclonal, and what other treatments are out there?
So as far as monoclonal antibodies, these are used to prevent patients from worsening. So people who meet certain criteria, they have body aches and fever, so they do have systemic manifestations. If they get the monoclonal antibody, we can prevent them from worsening to the point where they'll end up in the hospital. And that has been our experience. In one of the papers, they were able to cut the hospitalization down from 6% to 2%. I think that as long as it's available, we should be using it as much as possible. God knows we need it down here because people are unvaccinated, they get sick, we have to do something for them. As far as other treatments are concerned, I think the most time-tested, proven treatment is the steroids. We know those work. Remdesivir, if you give it early on, it has a mild effect. It's not as effective or as efficient as the steroids are. And then we've had things like Actemra, baricitinib. I think those play an adjunctive role with the steroids.
Okay, I want to talk to you about something that you've been personally involved in. When the school year began, there was so much fear and trepidation. Frankly, it got off to kind of a rough start. We had some schools close. We had schools then have the mandatory mask mandates. I know you've been following contact tracing in schools. I've always thought that was an impossible thing to do. What have you concluded or learned about that?
So, David, first of all, our contact tracing efforts were right at the beginning last year. After that, we couldn't continue those. In the beginning, when we did this, we were able to identify certain parts of Jackson County that were really being affected more than others, and we were able to speak to the local government out there and affect that. In the schools, we haven't been able to do contact tracing per se. We've been following with great interest peripherally, but I can't say that we've been doing anything contact tracing-wise with them.
All righty. Well, Dr. Babar, God bless you and everything you've been doing, along with all of your colleagues and all healthcare workers all around the country and around the world. Thanks so much for being with us. We appreciate it.
Thank you, David. Appreciate it.
And stay with us. We're going to take a little break.